So tell me how, I think, how has sort of college life during this ongoing pandemic changed for you? So if you can talk maybe a little bit more about your current clinicals. Are any of you in community right now, or are you all in complex care? No community? Okay, so I did see there was a chat, there was a question, and I can address the community side a little bit from our students, but I didn't know if we had any specific. But talk a little bit about how your college life has changed. Reagan, you want to start us?
Sure. So campus is very different than what I'm used to. Being like from so far away, I always get asked like, why'd you pick Michigan? Like that's all the way across the country. There's plenty of good schools in California, but I wanted a really big school and I wanted to go to a direct entry nursing program because I knew that's what I wanted to do. And, I'm so glad that I got my first 3 years at Michigan, like done. I'm so glad that I got the full freshman experience. And I'm glad that, I was able to go to the big house and go to a football game and things like that. But, I think this is definitely like, not to put it lightly, but this is a disappointing year. As a senior, you have a lot of like hopes. And I mean, I have a bucket list of like all these things that I haven't gotten to do yet that I want to do before I graduate. And so to not be able to do a lot of those things and to not be able to like be in the classroom with my peers that I've like been in the same room with since freshman year is like is so strange. There's people that I was super close with in the nursing program that I feel like I haven't seen since last year because in reality, I don't think I have just because of the conditions we're in. And I think there's still like stuff to do on campus and you still have your friends and your roommates and things like that. But at the same time, like being a nursing student in this climate is really very stressful at times because I'm constantly worried that like no matter how hard I try to like protect myself and no matter like how well I like um not obey the rules but like follow the guidelines that are set in place, like you're just, if you leave your house there's a risk of acquiring COVID and I don't want to get sick because I want to continue to go to my clinical experience. And so there's a lot of mixed emotions for being a senior in this kind of environment just because it's not the same Michigan experience that we've had the last 3 years of our college career. But I try to be glass half full as best I can and kind of reassure myself and tell myself that all these things we're doing now, like, if we're able to get like some sort of small semblance of a graduation ceremony in the spring, like then it'll be worth it. But, it's definitely different and it's not what you hoped for, but these are the things we have to do. And as healthcare providers, it's important that we set an example for the people around us, and, follow the guidelines and be something that other people can look to.
Great, thank you, Reagan. Griff?
Yeah, I think going on what Reagan said, it definitely is not the senior year we anticipated or hoped for. Um, However, I think that I was fortunate to for one of my electives to have an in-person class, and so it kind of gave me some normality, which was nice. And I think that at U of M we've been doing a great job on campus to slow and stop the spread, which has been a good thing. I know it's challenging, especially as the weather gets colder, but I think that we've definitely come together to do that, to work towards this common goal. I think that there are not a lot of people on campus as much as we're used to, which is different. I think the whole vibe of campus is a little bit changed. I think even going through downtown Ann Arbor, you can see that some of the same places we're used to going to are no longer there because of the economic effect of COVID-19. And so I think that even changes the vibe of being in college and being in this exciting downtown area, and not seeing, your favorite coffee shop or favorite restaurant to go to with friends. Um, and even being able to do that, because again, like Reagan said, there's a risk of doing those things, and it is challenging. And you want to be able to go out and be with friends, and you know, have some time away from school and everything else. But it's really challenging given the current circumstances.
Sure, yeah. Jess, do you want to add anything in addition?
Sure. I think the biggest thing for me was just transitioning from in-person learning to online.
Mhm.
the School of Nursing has obviously done an amazing job. They have provided us with a bunch of resources, and I so appreciate that. But I am like an in-person learner. I do like human interaction, talking with my friends, asking questions. And so I think that's been really hard. And then in terms of social, I live with 10 other girls. So kind of knowing what my boundaries are, what's important to me, my patient safety. Currently I'm on a peds oncology floor, and those are the most immunocompromised patients. And so just recognizing that the risk of bringing anything into the hospital to them is so great that I know where I stand and what I feel comfortable doing. That being said, being stuck inside with 10 other girls, you get to know people on a different level. It's more of close relationships and things that I don't think would have happened if we weren't all isolated. So yes, there's definitely been difficult parts, but like Reagan said, just keeping your cup half full, that's really important.
Yeah, absolutely. For all of us, right?
I just want graduation. That's
yes,
it.
I know. We all want that. So just for the audience, just to give you a little bit of a background in terms of how the School of Nursing is made some modifications. I think, as the students mentioned, many of our didactic courses are hybrid or fully online. Part of the reasoning for that was related to just simply size. Following the social distancing requirements certainly limits the number of folks that we can have in a particular class at a certain time. So most of the courses that the didactic are hybrid. Some do have that option of coming into class, but it does require sort of prior registration. So there's a lot more complexities involved. The other thing just for you all, we do have some really, we're following the public health informed guidelines. So masking anywhere on the university campus is a requirement, both indoors and out. There's screening that happens when our students and faculty and staff enter the building to assure that they don't have any symptoms of COVID or haven't been in any close contact with anybody who is COVID positive. And then again, the social distancing piece. The nice thing is we cannot say enough positive about our clinical partners. They have been so supportive of having our students engaged in that work. They recognize that importance. So not just, Michigan Medicine is a huge supporter, but also a lot of our community sites as well, and those sort of outside of that university realm. So I can't say enough about that, just from an administrative perspective, as well as having those relationships that say, yes, we know we want the students to be there to learn. In terms of, there was a question kind of related to community experience. Many of our community sites have in the past been public or not necessarily all public, some public-private health, so school districts, county health departments. We've had, a variety of other different community settings that our students have been engaged at. The things that have been modified, first and foremost, is there are quite a few opportunities now where our community experience is virtual, simply because some of the schools in that area, the districts that we work with, are virtual. They don't have in-person learning. And so we've been able to adjust and modify for our students within that community rotation to still work with those school districts, but they are doing it with virtual projects and presentations and other ways in which they're connecting. The other thing is we have a group of about 20 of our senior students that are doing contact tracing within the university, as well as in collaboration with the county health department. So it's just part of the bigger process of trying to prevent that spread. And it's a way that our students truly just got engaged, and being sort of part of the experience of within the community, coming together with the interprofessional team. So part of that group of doing a lot of that work includes public health students, you name it, all the different health schools have been engaged in that work. So that's sort of how we've handled some of the community. I don't know if any of you three have had any specific community experiences to date. They're all in a rotation that I believe it will be next term that they will have their community clinical placement. So I want to kind of move along. I hope that helps just our audience get a little bit more of a feel for, sort of how it is and what we're doing within the campus setting.